Areola reconstruction or repigmentation is a delicate procedure, carrying a huge emotional weight. Whether we're talking about a post-mastectomy context, scars after reduction or augmentation, burns, or correcting congenital asymmetries, properly preparing the skin and body is the first step toward a beautiful and lasting result. First of all, the area must be completely healed. If you've undergone surgery, the general recommendation is to wait at least 12 months until the scars become flat, lighter in color, and are no longer sensitive to the touch. In the case of burns, the waiting period may be even longer, until the doctor confirms that the skin is completely healed. Moisturizing the skin is essential. In the weeks leading up to the procedure, apply a nourishing cream or oil daily to the breast area to restore its elasticity and prevent dryness. Supple and healthy skin absorbs pigment much more evenly and retains it better. Avoid exposing the breast area to sunlight or tanning beds for at least 4 weeks before the procedure. Tanning, whether natural or artificial, can alter the skin tone and may affect the choice of pigment color. If you are undergoing any medical treatment, such as hormone therapy after breast cancer or taking anticoagulants, please let me know in advance and discuss it with your doctor. In certain situations, it may be necessary to adjust the timing of the procedure for your safety. On the day of your appointment, avoid coffee, alcohol, and nonsteroidal anti-inflammatory drugs like aspirin or ibuprofen, as they can increase skin sensitivity and the risk of bleeding. Wear loose, soft clothing that doesn't rub against the breast area or cause irritation. As a professional, I will carefully examine the area on the day of the procedure. Your skin texture, tone, scars, and the specific characteristics of your breast. Together, we will discuss the ideal shade and the technique that will give you a natural, three-dimensional effect, restoring not just aesthetics but also your confidence. If I notice that your skin isn't ready, for example, if it's too sensitive, too dry, or there's redness or inflammation, we'll reschedule. Not because of unnecessary delays, but because I want the final result to be flawless and long-lasting. Preparing for areola dermopigmentation isn't just a technical step, but also an emotional one. This is the moment when you prepare your body and mind for a change that often marks the end of a difficult chapter and the beginning of a new one. And I'm here to make sure this moment is not only beautiful, but also completely safe.